Okay, welcome back, everybody. I hope you had a good break, was able to get a drink, something to eat, a bio break, whatever you needed. We're going to finish out our afternoon here on this session. Our first speaker is actually myself, so I'm going to switch from moderator mode to presenter mode. So bear with me one moment. I'm going to share my screen.
There she is. I'll say, hi, everyone. Christine got kicked out, so we'll give her a second to get back up. Look like there she is.
Okay, can you see me? Can you hear me?
Yes, looks good.
Okay. Are you seeing my slides or no?
Not yet.
Okay. It looks like.
All right, give us one more minute, everyone. It seems like we lost Christine again, so there must be an issue with sharing of the slides. So we're currently trying to rectify that situation.
Can you hear me?
Yes, we hear you, Christine.
Okay. It seems that it's not going to let me do both.
Would you like for us to share? There we go. Chelsea's got you. Thank you. I'm signing off.
Okay. Yes, and I just need to. Okay. Great. Thank you, Chelsea. I appreciate that. So I'm going to have to use my monitor over here. So my apologies if I am not looking directly at you from my laptop. Sorry about that. Okay. So thank you all. Sorry for the technical difficulties. So we've heard some really great presentations these past couple of days related to our theme of norovirus. And this topic fits right in with that theme. We're going to talk about assessing employee health while you're out in the field conducting your routine inspections. So let me ask those of you in the audience who are regulators, how do you have the biggest impact when it comes to employee health and safe preparation of food? Next slide, please, Chelsea. So as you all know, Chapter 2, Subpart 2-201 addresses these three areas you see in the bullet list here: responsibilities and reporting symptoms and diagnosis, conditions of exclusion and restriction, and managing those exclusions and restrictions. So we're going to dive into this part of Chapter 2 during this presentation and discuss how to assess employee health while out conducting your routine inspections. I'm going to show you some examples of how that can be done and review the many tools you have available to you in the annexes for determining when and how these exclusions and restrictions need to be implemented. Next slide, please, Chelsea. The food code tells us that food employees are required to report to the permit holder any information about their health when it involves diseases that can be transmissible through food. It describes symptoms that must be reported and potential exposures that also must be reported to the person in charge. And once reported by the employee, it is the responsibility of that person in charge to, one, determine if the food employee needs to be excluded or restricted, and two, to notify the regulatory authority if an employee is jaundiced or received a diagnosis with an illness due to a pathogen specified in 2.201.11 A2 A through F. So how do you, as the regulatory authority, know your establishments are complying with these requirements? How can you be sure? In our next slides, I'm going to show you tools that I hope will help you make that determination when conducting your inspections. Next slide, please. What things are you currently doing to assess employee health when conducting your inspections? Do you ask questions of the person in charge, such as, have any employees called out sick recently? Do you ask about employee illness policies and whether they are implemented, written, and whether employees have been trained in those policies? Do you look at work schedules that are typically posted in the back of the house? All of these things are a great way to gather information you need in order to do a proper assessment. Next slide, please. We're going to watch an example from the field. Go ahead, Chelsea.
So have any of your employees called out sick in the past 7 days?
Yeah, one of my line cooks called that on Tuesday, actually.
Do you know why he called out or what his symptoms were?
No, I didn't ask what their symptoms were. He just said he wasn't feeling well, so I told him to stay home.
So if you don't ask him about his symptoms, how do you know when he's allowed to return back to work?
Whenever he feels better, I guess.
So let's say your employee called out on Tuesday and was having symptoms of vomiting and diarrhea. Do you know how long that he should stay out of the establishment?
No, I don't.
It's okay. So anytime an employee is sick with any undiagnosed vomiting or diarrhea, they need to stay out for 24 hours after their last symptom. So let's just say your employee got sick on Tuesday and it was well into Wednesday morning, then he wouldn't actually be able to return to work until later on Thursday, because that would give him the full 24 hours after his last symptom.
Really? I didn't know that. So what's the point of the 24 hours?
So first, it is the code, the health code, but also because he's going to be shedding his virus for up to 24 hours after his last symptom. So we wouldn't want him to get anyone else sick.
Wow, okay, I didn't know that. Yeah, I'm gonna step away for a minute if you don't mind. I'm gonna just give him a call, see what his symptoms are, and see if he needs to stay out an extra day.
Great, thanks.
Okay, so can you go back one, Chelsea? I'm sorry. Thank you. So in that video that was made in collaboration with FDA and the Chatham Health District in East Hampton, Connecticut, and the Flower Girl Bakery, which is also located here in Connecticut in Hebron. Special thanks to them for agreeing to be on camera. So in the video, you saw how the regulator asks questions of the person in charge to determine if they have a proper employee health policy in place. So in this particular scenario, the establishment did not have an adequate policy. So the inspector provided valuable educational information to the person in charge. Next slide, please. Okay. You'll have to click a couple times. Thank you. There you go. So takeaways from this example. So here's some of the things we can learn from that particular video. That asking if anyone has called out sick recently can prompt additional conversations with the person in charge, management, employees. In this particular example, the inspector stopped a potentially ill food worker from coming back to work too soon, which, as we all know, could definitely have averted a foodborne outbreak from happening. So these conversations between the person in charge and the inspector are great opportunities to provide those education intervention strategies that are so important to create that behavior modification that we all want to see. Next slide, please. So let's look at another example of how you can assess employee health while conducting your inspections. In this example, you'll see that the regulatory official asks the person in charge about their ill food worker policy, and the establishment has a policy in place. However, there's still room for some improvement. See if you can spot what is missing from their policy.
So have any of your employees called out sick today or in the past 7 days?
No, I've been really lucky. My staff's been healthy lately.
Oh, that's great. So tell me about when your employees do need to call out sick. What's the process?
Well, we have them call at least 2 hours in advance so that we can try to cover their shift, and they have to talk to the manager on duty.
And do they have to tell you what their symptoms are?
Yeah, well, the manager is required to ask them if they have any vomiting and diarrhea or if they've been to see a doctor or diagnosed.
So when they are experiencing vomiting or diarrhea, what would the manager do then?
Well, based on our purpose policy, the employee would be required to call back and let the manager know if their symptoms have stopped, and the manager would then let them know when they can start their next shift. They also have to do a form that they have to fill out and send it into our corporate office, and that's letting us know that somebody was out with the illness.
Okay, that's great. Do you also notify our office when this happens?
No, I didn't know I was supposed to do that.
Well, it depends. If you have an employee who's experiencing vomiting and or diarrhea, then you don't need to contact our office. You do need to be sure to exclude them for 24 hours after their last symptom. However, if you have an employee who notifies you that they have a confirmed diagnosis of one of the big 6 pathogens, then you definitely need to contact our office. The big 6 pathogens include norovirus, hepatitis A, Shigella, Shiga toxin E. coli, Salmonella typhi, and non-typhoidal salmonella.
Great, so do we call you?
You can just call our main office and let the admin know, and she'll get in touch with me and let me know.
Awesome, well, that's good to know. Thank you.
Okay, so in that particular example, the reporting component was missing from the establishment's policy. So remember that 2-201.11B requires the person in charge to report these situations to the regulatory authority. Next slide, please. Next slide. Next slide. Thank you. Okay. So in that video, the establishment had the policy. They knew to exclude the worker for the proper amount of time after symptoms had subsided, but they were unaware about contacting the regulatory authority when a worker had been confirmed of certain illness etiologies. So remember that section 2-201.11B, which requires that. So let's see. I'd like to ask all of you, how many of our regulators here have actually received a call from an establishment letting them know about an ill food worker? You can go ahead and put it in the chat if you like, or and also, are there any industry partners who are on right now who have actually called the health department to report an illness? So let's take a minute to talk about the type of guidance that you, as the regulator, could provide to an establishment who was calling you to report an ill employee. Next slide, please. Okay. So if you take a look at the annexes section of the food code, you'll see in Annex 3, there are multiple decision trees to help the regulatory authority, as well as our industry partners, understand when an employee should be excluded or restricted based on the specific situation they are experiencing. So let's take a look at an example of this. Next slide, please. You can hit play. Thank you.
Have a day, Guam Division of Environmental Health. This is Leilani Navarro speaking. How may I help you?
Hi, this is Joanna. I am the manager at the Holiday Island restaurant. I'm calling because I just had one of my lunch employees call in sick because they were diagnosed with non-typhoidal salmonella. I know from the trainings I've attended and based on my policy, this is one of the diagnoses to report to you. This employee is one of my chefs, so I thought I should call you and make sure we are following the food code requirements. Are you able to provide guidance on what we need to do?
Oh, wow. Yes, thanks for calling to report this. Let's walk through this together. Do you have a copy of your employee health policy? If not, we can also take a look at section 2-201.11 and 2-201.12 of the food code.
Thank you. I have a copy of the employee health policy with me, which is mirrored after the FDA Employee Health and Personal Hygiene book.
That's great. The book and also the food code annex provides decision trees and tables to help you determine what you need to do. Let's go over it together. First, let's figure out what decision tree we will be using for this case. So based on what you said, your employee was diagnosed with non-typhoidal salmonella. In this case, we'll use decision tree 1.
Got it.
We'll go to the second block that says, if the food employee is reporting a diagnosis with hepatitis A virus, NTS, or typhoid fever, since your staff is diagnosed with non-typhoidal salmonella, they should be excluded per Table 1B. So this table provides a breakdown for each of the diagnoses, exclusion requirements, whether you are serving a highly susceptible population or not, when to remove the diagnosed employee from exclusion, and if approval is required from the regulatory authority to return to work. Let's go to the row for non-typhoidal salmonella.
Got it. I already started that first step by not letting them report to work today. Now the question is, when can they come back?
Yep, great job on that. The next column provides that information on when they can return to work. So for non-typhoidal salmonella, you would need to have them provide the medical documentation stating they are free of a non-typhoidal salmonella infection, or they don't have symptoms of vomiting or diarrhea, and more than 30 days have passed since they became asymptomatic. Approval is needed from us to have them report back to work.
Awesome. I know my next steps now, and we'll keep you informed. Thank you for taking the time to help me with this.
You are most welcome.
Special thanks and a shout out to the Guam Department of Public Health and Social Services for participating in these videos, along with FDA and our retail specialist, Catherine Del Mundo. Okay, next slide, please. Okay, so where can you find these resources? Where are these decision trees? So the Food and Drug Administration has developed this employee health and personal hygiene handbook to encourage practices and behaviors that can help prevent food employees from spreading viruses and bacteria to food. It is a great resource that includes all about the things we've discussed here today during this presentation, including all the decision trees that we're highlighting, the exclusion and restriction parameters, and provides a great overview of why policies that address employee health, proper hand washing, and bare hand contact are vitally important to help prevent the spread of foodborne illness. The web link is shown here under the picture. Here you can download the entire publication directly to your computer for your personal use. And I encourage you to please share this publication with your food establishments as well if you feel it would be beneficial to them. Next slide, please. So in the previous video we watched, an establishment owner called to report an ill food worker. But what if the establishment calling to report an employee illness serves a highly susceptible population? Are there different requirements for employees working in these types of facilities? Let's watch this next video and see how our regulators assist with this situation.
Half a Day Guam Division of Environmental Health, I'm Lisa Oriando speaking. How may I help you?
Hi, this is Shane Mendiola. I'm the manager at Pacific Island Medical Care. I want to report to you that one of my staff was diagnosed with Shigella by their doctor. I checked with my staff and they feel fine. Are they able to come into work since they aren't feeling anything?
Thanks for calling. That's something we really need to know. I'm glad you're reporting it and seeking guidance from us. Do you have a copy of your employee health policy? If not, we can also look at sections 2-201.11 and 2-201.12.
I have a copy of the employee health policy with me, but I am new to the job and a little confused on what my next steps are.
That's okay. The Food Code Annex provides decision trees and tables to help you determine what you need to do. Let's go over it together. First, let's figure out what decision tree we will be using for this case. So based on what you said, your employee was diagnosed with Shigella but not experiencing any symptoms at all. In that case, we'll use decision tree 2A, when to exclude or restrict a food employee who is asymptomatic and reports a listed diagnosis under the Food Code. So you've already said that they don't have symptoms and that they were diagnosed with Shigella.
Yes, no symptoms, and their doctor said Shigella.
Got it. Then the decision tree says to exclude per Table 2 or Table 3. Table 2 is a summary of the requirements for diagnosed food employees with resolved symptoms, while Table 3 is a summary of requirements for diagnosed food employees who never developed gastrointestinal symptoms. So in our case, we will be using Table 3.
Got it. Okay, let me pull up Table 3.
So this table provides a breakdown for each of the diagnosed pathogen, exclusion or restriction requirements, and whether you are serving a highly susceptible population or not, when to remove the diagnosed employees from exclusion or restriction, and if approval is required from the regulatory authority to return to work. Let's go to the row for Shigella.
Got it. I see that my staff should be excluded then, so I'm glad that I didn't have them come in.
Yes, great job on that. And the next column provides the information on when they can come back to work. For Shigella, you would need to have them excluded from work until approval is obtained from us, and they have been medically cleared, or more than 7 calendar days have passed since they were last diagnosed. Again, approval is needed from us to have them report back to work.
Okay, that's great. I know my next steps now. I will reach out to you once they can provide either one of those documentation and check with you when they can come back. Thank you for taking the time to help me with this.
You're most welcome. Any questions you have, please let me know. Thank you again for calling. Bye.
Sorry about that. I was on mute again. Next slide, please. Okay. So not only are the decision trees available in the Employee Health and Personal Hygiene Handbook, there are additional resources here as well. And this slide shows all of the forms, tables, and decision trees that are available to you as a resource. So forms such as a reporting agreement that can be used by an establishment's person in charge and employees is available. And the tables that summarize the requirements for exclusion and restriction, just as you saw in the previous video, are also available within this guidance book. Next slide, please. Okay, and let's watch one final scenario and see how the regulatory authority handles this particular situation.
Hafide, Guam Division of Environmental Health. This is Veneer speaking. How may I help you?
Hi, this is Jody. I'm the owner of Guam Hospital and Nursing Care. I want to report to you that one of my staff who called in reported they have a family member diagnosed with hepatitis A. I checked with my staff and they aren't diagnosed. What do I need to do?
Hi, Jody. Thanks for giving us a call. That's something we really need to know. I'm glad you're reporting and seeking guidance from us. Do you have a copy of your employee health policy? If not, we can also take a look at 2-201.11 and 2-201.12.
Thank you. I have a copy of the employee health policy with me, but I want to make sure since we do serve a highly susceptible population.
That's okay. The Food Code Annex provides decision trees and tables to help you out. Let's go over it together. First, let's figure out what decision tree we'll be using for this case. So based on what you said, your employee was exposed to hepatitis A, but not experiencing any symptoms at all. In that case, we'll use decision tree 2B when to restrict a food employee who reports a listed exposure under the food code. So going through the decision tree, we want to make sure that they aren't experiencing the symptoms and they aren't diagnosed with it.
Yes, no symptoms and they weren't diagnosed with hepatitis A.
Got it. We then move down, and as we can see, the decision tree asks if they are reporting exposure, which your employee is. Since your facility serves HSP, the food employee is to be restricted per Table 4.
Got it. Okay, let me pull up Table 4.
So this table provides a breakdown for each of the diagnosed pathogen, exclusion or restriction requirements, and whether you are serving a highly susceptible population or not. When can the restricted food employee return to work? And if approval is required from the regulatory authority to return to work. Let's go all the way down to the row for hepatitis A.
So, I see that per this table under facilities serving an HSP, my staff should be restricted.
Yes, that's correct. You can find this also in section 2-201.12b of the Food Code. The next column provides that information on when they can return back to their regular duties by meeting the following conditions. 1. The food employee is immune to hepatitis A infection because of a prior illness from hepatitis A, vaccination against hepatitis A, or IgG administration. Or 2. More than 30 calendar days have passed since the last exposure, or since the food employee's household contact became jaundice. Or 3. The food employee does not use alternative procedure that allows bare hand contact with ready-to-eat food until at least 30 days after the potential exposure, and the employee receives additional training. Approval is not needed from us, but if you need additional assistance with training, I am more than happy to help you with that.
Okay, that's great. Thank you for walking through the requirements with me. I may have to reach out to you to take you up on your training offer, but let me take a look at what we have and schedule a call with you later. Thanks again for your help.
You are most welcome. Any questions you have, please let me know. And yes, definitely, let's schedule a call to talk more about the training. Bye.
Thank you. Next slide, please. Okay, I want to send a special thank you to the Guam Department of Public Health and Social Services, Chatham Health District, and the Flower Girl Bakery, all for agreeing to be on camera and do those videos. They were a lot of fun to make. Catherine and I had a really great time doing it, and we really appreciate the help from our state and local and territorial partners there and industry. Next slide, please. Okay, so I'd like to go ahead and open up the floor for any questions that you may have or any questions that you put into the chat. Additionally, I'd like to ask of you all if you have any additional tips, tactics, or methods of assessing employee health that have worked well for you that you would like to share. Within the conversation board at the top tab on the Pathable website, we do have a chat thread going regarding employee health, assessing employee health and interventions. So if you would like to contribute to that, by all means, I encourage you to do so, share your experiences. We can all learn from each other. And have you implemented any intervention strategies with any of your establishments that have worked well to bring them into compliance with employee health requirements? Definitely contribute to that if you do have something to share. So Kenya, I am going to ask, are there any questions in the chat?
Yeah, we had one further up in the chat, Christine. There is a question concerning, they were piggybacking off of our neural session from day one, and they wanted to know, they said in the neural session, it was said that a person can shed up to 2 weeks after symptoms are gone. So should they be asking if a person was tested for norovirus?
Should they be
coming from a
asking?
regulator doing an inspection?
Okay, should they ask if they were tested? I don't believe it is a requirement to require testing, but correct me if I'm wrong, please. If they are reporting those symptoms associated with norovirus, you definitely want to make sure that exclusion and restriction takes place. Testing is not a requirement though, but they could ask. I'm not sure that would be appropriate, but right. Yes, it's the exclusion and the restriction that is really the key parameters there.
Kudos. I agree. That's how I would have answered it. The food code does not require that you guys as regulators ask if they have been tested for norovirus. Let's see, any other questions for Christine? I think it was, Christine, you got a lot of great comments about the great videos. I know some folks were having issues with sound, so we do apologize for that. We are going to get links to these videos and post them as soon as possible probably will be in the Files tab here on Pathable site. Let's see, someone asked, looks like a question from Marie. Does HIPAA apply to all of this employee health stuff? Christine, what do we think about that? Does HIPAA apply here?
No. In terms of asking if any employees have been sick or have called out recently, no, that is not protected health data. So a regulator can ask those questions. And in terms of an operator asking an employee if, what their symptoms are when they all are calling out sick, that is not protected health data as well. So to ask those questions, no, that would not apply.
Great answer. Let's see. I see someone has a comment that says chat is disabled in Zoom. Yes. And for all of your questions, if you have any questions for Christine on employee health, please put them in the passable chat, because I believe for attendees, the chat is disabled in the Zoom format. I'm scrolling down. We got a lot of comments, great videos, great job. And shout out once again to the health departments, Connecticut and to Guam for helping. Excellently, great work there. Let's see, I don't see any more. I see a lot of excellent presentations. Let's see, we've got a question. Does the employee health book come in other languages? I don't think it does. Christine, do you know if it's, I don't think it comes in another language.
No, I believe on the site, it's only downloadable in English currently. That would be a question for, I'm not even sure who would do that translation.
Yeah, if any of our CIFSAN counterparts are here and can respond to the question, I don't think it's translated, but please reply in the comment section under that one. I don't think it is, though. We got a lot of chatter in the chat about good resources for SOPs for norovirus event. So if you guys have access to that question, please respond. We have some links in the chat to FDA's website, and you've got some resources on there as well. Let's see.
Excellent.
Let's see. I'm trying to go through questions. I'm sorry.
Okay, keep in mind, I am the newest. I'm the newest specialist, so keep the questions to a minimum, please.
but you're doing great, Christine. You are doing great. And I got a ping from, thank you for one of our CIFSAN counterparts. The handbook is only in English right now. Thank you for that.
Thank you.
Shout out to Robert Sutler. He's always on top of it. Question in the chat here. Is in the event, such as the last video example, when it states that further education or training is needed, is there a certain standard for the more training? Thought-provoking question there.
Is there a standard? I mean, there's not a provided standard, but there are a lot of resources that you can definitely tap into to help them with that training. And I would encourage definitely to reach out to your specialists and try to get your hands on what is available through FDA and the associations that can help with that.
Very good. As I'm scrolling back through chat, I see one of our partners at CDC, Beth Witchery, has placed a link also to some infographics for sick workers that CDC has developed. So you guys take a look at that in chat. Thank you, Beth, for that. Some more thank yous, Christine. Very informative presentations. And we got another question right here. So as part of the interview, do you suggest, should you ask if the food worker works at another restaurant?
That is a great question. And yes. In my experience, we actually have had outbreaks happen and then have a second outbreak either at another establishment that was owned by the same restaurant owner, who they did share employees amongst the different establishments. So that is a great question.
Let's see, we've got someone looking for a training video, like it's from Kimberly Stryker. Comment says, has anyone developed a training video to train a person who has been diagnosed or who has had contact with someone with a covered illness? So if any of you jurisdictions, folks listening out there have done that, please respond to Kimberly's question there. Let's see, we've got some more links. CDC posted there, some links here in the chat for the employee health form that has been translated into Chinese and Spanish. She put her email. And then we've got shout out Georgia Department of Health here has put in links also for translations for English, Spanish, and Chinese. And I don't think I have any other questions, Christine.
Okay. Well, thank you very
Excellent
much.
job.
Thank you. Sorry for the technical difficulties, and hopefully the videos came across okay. So yes, and they will be available for viewing later. Okay.
All right.
Okay. So I'm going to jump back into moderator mode now. So thank you everybody for that. So our next presentation is going to be a panel presentation from our National Retail Food Executive Leadership Team. So this presentation is going to be facilitated by Kenya Moon, our moderator from Monday's session and who you just saw. So Kenya, I'm going to hand the floor over to you. Thank you.
All right, thank you so much, Christine. And once again, excellent. And y'all in virtual land, please give Christine a round of applause because she, like I said, she's our newest specialist and she jumped right in there and went for it. So great job, Christine. Excellent job. Great information, and hopefully our audience found it useful and can take it back to your jurisdictions. So let's see, so all of my panelists here, I see Andre's on the screen, Alan, we have Glenda, everybody else, do we have Janet available?
I'm having technical challenges, so I'm not on camera.
Okay, but we have her voice, so I'll do a little quick 5-minute spiel, so hopefully by the time we get to actually the question and answer session, we can have Janet's lovely face on our screens. Thank you, and I'd like to welcome you to our last official session of the day. Y'all, we have made it, yay. Once again, thank you for attending our seminar, but we are super lucky to have 4 of our top leaders here at FDA with us to have a little conversation. We are gonna chat, we envision this as kind of a sort of session like them having a casual conversation, drinking a cup of coffee, you know, eating bagel. I tried to get a background, so hopefully you can smell the coffee or the bagels and pastries baking. We want to have like a conversation here so that you guys can understand more about what our National Retail Food Team is and what it entails, or who makes it up. So I want you to, our audience here, take a look at your Passable chat. And I'm going to start off with asking you a question. How many of you out there in our seminar world here have heard of the FDA National Retail Food Team? Could you put a yes or no in chat? Have you heard of the FDA National Retail Food Team? So let's see, I have some yeses, some no's. Yeah, okay, got some yes. A lot of no's here. All right, good. So good mixture. So that kind of gives us a gauge of where we can go with our conversation here. I also have a little insider information. I know that we have a lot of first-time attendees to the seminar, so welcome. And you may not be fully aware of what the National Retail Food Team is. So several of you said that you did know. Well, I am a retail food specialist here with FDA, and all of the other wonderful specialists that you guys work with are part of what's called the Office of State Cooperative Programs. And I hope for those regulators out there and even industry partners, hopefully you have connected with your specialists. If you have not, I'm going to put a link in the chat to where you can actually find who your specialist is so that you can reach out to them. We are kind of, when I first started this position in 2016, I was told by a very wise person that retail food specialists are kind of looked at as the face of FDA because you guys will see us out there at the field level. We'll be working with you sometimes even on a daily basis, whether it's in person, by phone, or by email. We usually have some kind of communication every day with you folks that are at the field level, where I like to think we're the boots on the ground type of situation. So that's a part of the Office of State Cooperative Programs. What you may not know is that our National Retail Food Team is combined of 4 total offices, folks from 4 total offices. So we're going to talk about those offices now. I'm going to briefly mention them, and then the representatives are going to talk about them more a little bit in depth. First, we have the Center for Food Safety and Applied Nutrition, or CFSAN for short, and the Retail Food Protection staff of CFSAN are what I like to think of as the policy leg of the National Retail Food Team. They're going to provide, they're the food code folks. They provide that science-based regulation and provide those education materials to help advance public health. We also have the Office of Partnerships, or OP for short. So the money people, these are the folks that anyone that works for a jurisdiction, if you guys have received a grant or a cooperative agreement, then OP is that office that actually kind of organizes or has those funding agreements, and they coordinate those agreements with you all. Office of Training, Education, and Development, or OTED. This is our training leg of the National Retail Food Team. They develop and administer those training courses that you guys love, like those risk-based inspection courses, the food code course, temporary food events, all of those wonderful retail courses. Those are orchestrated and administrated through OTED. And then lastly, but not least, but I've already mentioned OSCP, Office of State Cooperative Programs. This is the field component. And this is where your specialists are located. We conduct standardizations, conduct training, and promote program standards. So all four of those offices, and the folks that are represented are going to introduce themselves shortly in a few minutes here. They sit Center for CIFSAN, Center for Food Safety and Applied Nutrition. We've got OP, Office of Partnerships. We've got OTED, Office of Training and Education Development. That's Janet, so she's going to come online in a second, and then OSCP. So all four of these offices work together to make our National Retail Food Team. And the ultimate goal of our National Retail Food Team is to reduce the occurrence of foodborne illness risk factors in retail food establishments. So without further ado, I want to pass the ball on now and let you meet these wonderful folks that we're going to have the discussion with this afternoon. And I'm going to start off with our Director of Retail Food Protection, Mr. Andre Pierce. So Andre, you want to introduce yourself?
Yes, can you hear me?
We got you.
Okay, so I'm Andre Pierce. I came here in January this year after 34 years in local public health, 16 years as an environmental health director in a county. So I'm coming from a lot of experience with program standards. And Kenya, you did a really good job describing what the team is. I guess, I really didn't know all the ins and outs of things before I came, but we're the Office of Operations. We're the boots on the ground, if you will, the retail specialist, and I'm very fortunate to be with this team. So our main core services are program standards, really getting out there and encouraging enrollment and active engagement. Of course, standardizations. We really are proud of the folks who've been announced as new standards during this meeting, and we really want to encourage you to go back to jurisdiction. We do training and education. We've offered SAVA workshops this year, symposium, the risk factor study workshops tomorrow, so that's going to be available. A lot of training and education. And then technical assistance. And that's a lot of questions that you may have, but it's also, our specialists can really help you think about your strategic direction. They can facilitate development of the program standards networks. And as you know, a lot of us will call our specialists whenever we have questions about the flexible funding model. So that's kind of who we are. Glenda?
All right, I'll go next. Hi, everyone. I'm happy to be here today. And I'm glad to see we have so many people online. So I'm just happy to have you here in CIFSAN, which is what you do at the beach, haha, when you sift the sand, right? But I've been at FDA for 25 years. And before that, my background is in environmental health. I was a local environmental health specialist doing retail food service and the general environmental health services, swimming pools, water and wells, septic, and the lead investigations, and a lot of the institutional and retail food safety. So, I've led the retail team in development of the food code at FDA. So very passionate about that. And we embrace really having the policy arm of our retail food team. And we really provide national leadership on retail food safety policy, regs, regulations, and guidance to agencies and organizations that are really involved in ensuring the safety of foods that are served to consumer. But we also have the interstate travel program within our division as well, separately. And some of our core services really that look at supporting the development, interpretation, and adoption of the food code. Everything kind of centers around that. And on that, we build connections across different program activities. And we mirror some of the activities that are in OSCP. But we also have we have the policy analysis arm where we're really looking at problem solving and the process of identifying and evaluating different policy options when recommendations come for changing the food code, we're the group that starts the conversation to say, do we say yes? Do we say no? What's the risk if you say yes? What's the risk if you say no? And so we apply a policy analysis framework in developing the food code. But we also are engaged in data and analytics and looking at investigating gaps in existing knowledge so that we can get policy relevant information to engage in. And we do qualitative and quantitative research and work with scientists that do that. Along with that, we do some policy surveillance and we say, well, what is that? That's really sort of looking at and monitoring the state of existing and proposed food safety laws and regulations over time. So we start to do that and generate information and data sets. We're also involved with standardization. We standardize our FDA retail food specialist as well as other federal agencies, and we provide technical assistance as well. It can be either directly with industry. We work closely with our specialists when questions come in, and also with academia, other regulatory agencies as well. And lastly, we're involved with outreach and communication with stakeholders, and that's through making sure promoting the food code, other food safety policy documents, tools that support that, like we just heard about the employee health guide, and different strategies and initiatives. So it keeps us pretty busy. So Alan, I'll turn it over to you.
Thank you, Glenda. And this is, I'm getting images here of the Brady Bunch. I'm like looking down at Glenda over to Andre. This is neat. Okay, so I've worked with Glenda for 25 years and I've never heard the "what do you do at the beach" sift sand joke. Okay, I love it, Glenda. That's great. So for those of you who don't know me, I'm Alan Tart. I'm the Deputy Director of the FDA's Office of Partnerships and the Office of Regulatory Affairs. And as Kenya said, we are the component that deals with money. So if you have a grant with us, no doubt you know Mary Beth Neeson or Janice Butler, two of our program managers who oversee our grants helping the retail program. We also have Barb Kate on our staff, who is our retail specialist who helps with the national program, kind of pulling people together in a steering committee. I've been with FDA for 25 years, and the last 7 of it has been as Deputy Director of Office of Partnerships, but most of the rest of my career has been in the retail program. So I've been really excited to see many of the names of folks that I have worked with over the years. I started off as a in the chat. I started off as a microbiologist in the Southeast Regional Laboratory, and then I was a retail specialist in Atlanta for 10 years. And then I loved training so much that I went to OTED and became a trainer for a few years. That was formerly the Division of Human Resource Development. And then I came to Office of Partnerships as the in-house retail specialist here. And then I moved into management. So I'm really excited to be with you all today representing Office of Partnership on the Retail Executive Leadership Alignment team. So, as I was looking over in the chat at many of the names I know and from industry and regulatory, academia, I'm just reminded of the skills and the vast talent that exists out there in the country. And I am not only excited to see you all, seeing many of you have switched over from regulatory to industry. Hi, Cynthia Walker from Florida. But I'm also lucky, as we all are, to have you all out there on the front lines protecting us from foodborne illness. So thank you for everything that you do on a daily basis. So just following up on Kenya's explanation for Office of Partnerships, we have $120 million portfolio of grants and contracts that we award to states, locals, tribes, territories, and associations. Most of that, almost 99% of that, is for the benefit of food safety. Retail is a small part of that. We have manufactured food, animal food, produce, eggs, also all of the state cooperative programs, retail food safety, shellfish sanitation, as well as milk safety, grade A milk safety. We have grants that support all of those programs. And we have a small portfolio of contracts that help further medical product safety. Within that portfolio, you are most familiar with the Retail Flexible Funding Model Cooperative Agreement and the Retail Regulatory Association Collaboration Cooperative Agreement, which you all heard a presentation on just the other day. We also oversee standards programs, not including retail, but we do oversee the standards program, the manufactured food regulatory program standards, the animal food regulatory program standards, the egg regulatory program standards, and we're working with NASDA and AFTO on creating produce regulatory program standards. And our office also oversees the rapid response teams, which are excellent partnerships between our FDA divisions and our state partners to respond to foodborne illness. And then last but not least, we also have a program in our office to determine return on investment. So with such a big portfolio of grants and contracts, we do need to make sure that we are getting a good public health return on investment. This helps us not only maintain the level of funding that we are able to provide to you all to help with your programs, but also to leverage for additional funding, as we've been able to do in the last few years with retail. So I'm excited during this segment to share some of that with you. I'm excited to share with you how we are able to show the value of the retail program to the agency and how we've been able to use that information to leverage for more funds and support for the program. Janet.
Well, thank you, everyone, and thank you for having us. And first, I have to offer you my apologies for no camera, but I will give you a visual. If you could just imagine a mid-age Halle Berry in the prime, and then just think about that, and that would give you an idea of the beauty that you are missing. So thank you very much. My name is Janet Williams. I'm the Division Director for Division of Programmatic Training in the Office of Training, Education, and Development. And OTED, as we are fondly known, does a lot. We, very simply, our office is responsible for providing training to the regulatory community. End of story. If FDA regulates a product, we provide training on it. That includes tobacco, medical products, that tongue depressor that your doctor uses, food safety, milk, everything. If FDA regulates it, we train on it. So while our portfolio expands well beyond retail, retail is near and dear to our heart because I am fond of saying no one should get sick from eating a salad. And I'm going to do my part. My division is going to do our part, and our office is going to do our part to make sure that we don't have that spread of foodborne illness out there. But we provide that training not only to our FDA regulators, the field that you see for the CSO, the consumer safety officers, we provide it to our state, our local, our tribal, our territorial partners, and sometimes our industry. We coordinate with academia. We work with industry a lot. We bring everybody to the pool together because we need a holistic view of how to get information to the consumer and to the regulator so that we don't have people getting sick from eating a salad. That's our goal. And OTED, I just gave you some numbers. Just for FY22, we delivered over 51 retail-only courses. There are more than 350 courses that my division alone delivered in all of those 8 FDA regulatory commodity areas. And if you think about the 51 for retail, that's at least 1 course per week. That's a lot. That's a lot of training. And there's a lot of people that are, we're making a good run on what we are doing in our reach out there. And not only do we do training, we do research. We do design, development, we do certification exams. We work on job task analysis, and the job task analysis is just a document that kind of highlights what does it take to do that job that we can use to kind of define how to develop training. We work on strategic planning. So while OTED is training, education, and development, our footprint is expansive in what we do. And we are very proud of supporting the national retail team, not only for the retail, but for all our commodity areas that we are working with. So Halle Berry out.
Thank you for that, Janet, or should I say Halle? We're
Yes.
Gracious to have you in our presence. Thank you, Janet. And you got a lot. I don't know if you can see the passable chat. A lot of people have commented, "Hello, Janet." They love Janet, so welcome. So they know you.
I was gonna say I miss my peeps.
Yeah. So hopefully you guys have heard something and learned something about the different offices. We're going to get into some of the questions now. And then as we're having our discussions as well, if you guys think of questions, if time permits, put your questions in chat and we can get to them at the end. So it was mentioned in some of the introductions that our strategic goal is to reduce the occurrence of foodborne illness risk factors at the retail level. So I'm asking this question of the panel: what do you all think is the biggest challenge to our collective ability to reduce foodborne illnesses at the retail level? And I don't know, I think Janet, are we gonna start with you with this one? You wanna take the stab at that one first?
Okay. Yes, Hallie here again. I'm gonna say, and I'm not gonna just confine my answer to training, because I'm talking as a consumer and as a person very passionate about the work that we do and the reduction of foodborne illness. I think there are a couple of challenges that we have. One of the biggest ones is that we don't have uniformity of processes across our regulatory agencies. And that doesn't mean everybody has to do everything the same way, but we should have some uniformity in goal, and we should have some uniformity in the direction that we're headed for outcome. I was on earlier and I saw the employee health videos, and what some powerful information was there. And it took me back to remind us about the risk factors. That's how we started our work in the reduction of foodborne illness, is identifying those 5 risk factors that were the lead contributors to foodborne illness. And out of that bore a lot of training for OTED that developed our risk-based inspection courses, our foodborne illness courses. And while those courses are important and they have trained a lot of people, they've done a lot of good, let's not forget the basics. The fact that you need to wash your dirty, stinky, nasty hands when you are working and serving food, that you shouldn't come to work sick. So that uniformity of process is what I'm talking about, making sure that our people understand the basics. And when they get to the training courses, it reinforces that for them and teaches them how to apply that information. So if we could kind of keep focused on that uniformity, I think that would do us a lot of good to reduce the illness. The other thing I wanted to talk about was the connection to the community. I think that sometimes as a regulatory community, we forget who we are doing the work for. We forget that we're serving the average person that's eating that salad or that's drinking that milkshake that's out there. And if we make them aware of the challenges associated with foodborne illness, not all the techie stuff, but the fact that if I'm in the facilities and I happen to be dining and in walks a health worker and they do what they need to do, but they start heading for the door without washing their hands, what do we do as a consumer? Do we make it okay and encourage our community to report that to the person in charge? Not in a mean way, so that they can then reinforce it. And when that person in charge reinforces it, they're not fussing at the employee, they're reminding them. So making it the norm that we all have a responsibility to reduce foodborne illness, I think will also go a long way. It's just not a regulatory task. It is everybody's role and everybody's job to keep us all safe. I'm done.
Thank you, Beyonce, or what Holly, the last one of the calls earlier this week, she used Beyonce. I think Beyonce's better, Janet.
Well, I have to change it up. I just can't.
Okay, you got to change it up. All right, they're both beautiful. All right, so just building on Janet and the response that she gave, I think we can all recognize that a lot has been done these past 20 years in retail food safety. I know you've heard during this seminar that this next year will be the 30th year anniversary of the food code. The food code, the retail program standards, the courses that Janet's group puts on, the standardization. We've done so much to try to reduce foodborne illness at the retail level in this country, yet the occurrence of risk factors and also the occurrence of foodborne illness has remained pretty steady, stagnant over that period of time. So why is that? And I think it's because despite all those best efforts, and I'm not saying that they weren't effective, we've also had, even better reporting of foodborne illness and that kind of thing too. However, we've got to do a better job of changing behavior. And that is, the $20 million question, like how do you do that? That's a lot of people working on that. We've tried to do that internally. We continue to work on that. It is the basis of the new era of smarter food safety and modernizing the retail program in this country. I think I'm going to butcher this study, but I remember seeing a study about hand washing over COVID, and hand washing increased over COVID. But now they've done a study and the hand washing has gone back to like pre-COVID levels. Why is that? So, why is it that we can get folks to wash hands in COVID, but not get folks to wash hands, or have a difficulty getting folks to wash hands when it's not a pandemic? And I think it deserves a lot of study and maybe application in how we can change behavior with our food service workers out there. And then secondly, I would say that the infrastructure of local health departments are still relatively depleted. This is from years and years and years of being underfunded. The stepchild of the health department in many cases, and we know that we need to put more emphasis on building the infrastructure and capacity of our local health department system out there. The standards are a start, but you need the funding that you need. COVID probably didn't help. And so I think, building the infrastructures of local health departments out there so that you can provide the assistance that you need to help industry achieve active managerial control is going to be vital to our efforts to reduce foodborne illness. Glenda, what are your ideas?
Wow, you guys touched on a lot of good things. Can you guys hear me? Or should I take can you hear me better? Is that better? Okay. You guys touched on a lot of good things that I think it boils down to people behavior consistency, right? We need compliance with the basics before you can build on that with anything new, innovative, creative. And sometimes we rush to get to what's new, the shiny new thing, and need to go back, just as Janet said, to the basics and really, I think it's staffing issues too, like you said, whether it's the health department or industry, it's those staffing issues post-COVID. It's maybe not having enough staff or existing staff, and the existing staff has become overstretched. And that looks like it may be becoming the norm. And so how do we work in that environment? How do we have people work in that environment when they can, when they're doing their job and really the job of somebody else's as well? And money, we always need money on both sides of the fence, devoted to retail to get things done. And I guess lastly, I'd say embracing new and innovative technologies. Sometimes it's hard to keep up. The world's changing fast every day. And so how do we as a regulatory community, as an industry community, keep up with that, with all of the changes that are going on, and keep the policy up to date and activities with it? I'll turn it over to Andre.
Guys are leaving me at the end, making it challenging. Yeah, I build on what Janet said, understanding the basics, and like you said, Alan, I think the biggest challenge is food safety culture. It's as environmental health specialists, it's the hardest thing. You've got a very difficult job to take in that information into that kitchen, to sell it to them, and to get behavior change. That's the biggest challenge. And I think I'd say another, maybe I'm getting ahead of the questions here, but I would say another one of our collective abilities to affect to change is we don't measure where we are to start with. In our own communities, are we really measuring? Are we really doing risk factor studies? Maybe we're making some headway in some areas, and maybe we're not. So from the OSCP side, we want to encourage you to do risk factor studies so we can really tell what's working and what's not. Those interventions that are really effective are really going to be something that will help us move forward and reduce risk factors in the facility. So these are all very good questions. I think operationalizing it is always really challenging. is always difficult to do. Thanks.
Definitely. So it sounds like I'm hearing from the conversation that we heard some training, consistency, uniformity, behavior change, that these are all some of the challenges or opportunity areas that we need to address. So it kind of goes into our next question. What is the FDA doing to reduce foodborne illness at the retail level? Sort of how are we going to address those challenges? And the second part of that question, are there any novel activities or initiatives that you guys can share with the audience that are on the horizon to help address those challenges? Who wants to take it first?
This is Beyonce, I'll go.
we got Hallie and Beyonce, go ahead.
For OTED, we're doing a couple of things, and we're very proud of the work that we're doing. I'm going to start with what I call the Independent Course Delivery, or the ICD program. Our office has been inundated in the past 5 years about making sure that we get training when people need it and as it's available. And we know that we are one office of 100 people. We cannot possibly train the 20,000 regulators that are in the regulatory community. So we have to find a novel approach and a novel way to expand the reach of our training that's there. And one of the things that we're doing is the independent course delivery. And I'm just going to give you the short shrift of it, but it allows OTED to develop the training materials, to develop the courses themselves using the science that we do to design and develop courses. We just don't throw a PowerPoint together. There's some psychometrician stuff in the background that's there, but develop that and develop instructor guides and materials and handouts and instructions, and then train qualified instructors to qualify them to be able to deliver that material on our behalf. So that when you get a training course from OTED or from the Alan Tart company or from Moon Corporation, it is uniform and it is the same, but it is delivered at your request, at your availability, and when you need it and how often you need it. We rolled that out this year. We have 5 courses that are in that pilot. Unfortunately, I'm sorry to say that retail is not one of the first 5, but if Janet has her way, it will be in the second group that we do starting in 23. So just hold on to that because we know that that has the biggest impact for the regulatory community, for our state, local, tribal partners that are out there. So Beyonce is fighting for you. The other thing that I want to talk about is at a higher level, 30,000 foot level. Alan and I co-lead a project on the Integrated Food Safety System Strategic Plan. We know that we have a coordinated strategic plan for all human and animal food. And so the highest parts of the organization came together and said, we have got to bring everybody together to make sure that we have an understanding. Hold on, let me turn this off just a second. That we have an understanding of what's going on out there in the community, and we bring all people that are interested in human and animal food together to help us develop a plan. That will be a 5-year strategic plan. We have partners from all of the organizations inside of FDA. We have associations at the table. We have state, local, tribal people at the table. We have retail, shellfish, milk. It's going to be a fantastic opportunities. So with that, I'm telling you that because you should be receiving what's called an environmental scan. That's a fancy word for a survey, but you should be receiving that. And that is the first step in the development of our strategic plan to help us identify what interests you. What are you concerned about? What are your priorities for the regulatory community for the near future? So those are 2 very exciting things. I have a lot more that I can talk about, but I'm not going to take up the time. But if you get that, please, please, please answer it because it is important. It is your future. Thank you. Alan?
All right. I didn't know it was going to be my turn. So this morning, I got really exciting news to share with you. This morning, CDC and FDA signed an MOU, a memorandum of understanding specific to the retail program. Now, we have a long history of working with CDC on retail food protection. And anything from research to, of what the occurrence of foodborne illness risk factors are out there, what are the contributing factors to foodborne illness, the environmental antecedents, what's causing folks what are the behaviors behind, or the causative factors behind the contributing factors. We've been working with them for a long time. This memorandum of understanding, and you all are seeing a picture of the signing ceremony this morning. Dr. Main, the Center Director over at Center for Food Safety and Applied Nutrition, Dr. McMeekin, our Associate Commissioner for Regulatory Affairs, and Dr. Bricey, who is the Center Director of Center for Environmental Health over at CDC, and our Senior Advisor for External Engagement, Abe Brown, are there in the picture. And they all signed an MOU this morning specific to retail food safety. And this MOU really expands and memorializes the partnership between FDA and CDC to work together to reduce foodborne illness at the retail level. How does this impact you specifically? We will be forming a steering committee after today, and the two groups will be working, and we will be putting together action plans for how we're going to achieve the objectives in this memorandum of understanding, including how we are going to work together to improve environmental health specialists' ability to do environmental assessments during foodborne illness investigations, how we can better impact behavior change, working together with the two agencies and putting our resources and leveraging our resources together, as well as how we can put better focus into conducting risk-based inspections to achieve, to help operators achieve active managerial control at the retail level. So we're really excited about this MOU. So I wanted to share that as kind of a novel thing that you may not be aware of. Also, another item I wanted to share with you is the retail modernization that's called for in the new era of smarter food safety blueprint. In particular, we know that we need to do different things, more novel things, more innovative things to reduce foodborne illness at the retail level. And this new era of smarter food safety blueprint has a list of deliverables, working with our state, local, tribal, territorial association, as well as our industry partners to execute different innovative things to modernize the retail food protection system in this country. So we're looking forward. I know you heard a presentation the other day on the work of the collaborative, but we're looking forward to what this initiative has in store for the retail program in the years to come. I think I am on to Glenda now.
Okay.
Glenda or Andre, anything to add?
Sure. I can go next. That's okay. We have a lot going on in the center that we try to do as our office. We're on the national team. First, we do research, as I said earlier, research and data analytics. So remember, that's how we investigate gaps in existing knowledge and policy, and we try to get relevant information. And just yesterday, we announced through our retail listserv FDA's research study. It's actually the second manuscript on the risk assessment of norovirus transmission in food establishments. And so we'll put in the chat, take a look at the link to that, that study. The authors are, some of the authors are in our center, right on the retail food policy team. So a shout out to them, to Lori Williams and Gervin Liggins. And, but more importantly, when we do research, we're looking at what are these findings telling us? How do we evaluate that? What do we do with that? How can we identify the needs that it tells us for either maybe updates to the food code? It can inform discussions. We're working with AFDO's 2030 work on norovirus. And so it can help inform those discussions so that we can come to decisions or go to what to take to the conference or what to bring to the conference for food protection to discuss potential policy changes or food code changes. And on that, the food code is turning 30 this year. as Alan said, or next year, I should say, in 2023. In its current format, it's started in 93, so it'll be 30 and 23. We're planning a year-long celebration, so get ready to see wonderful things on the website. We hope to perhaps have some of you in videos on your experience with the food code and how it's changed life in your community, really the basis for a lot of the state and local food regulations. And we're proud of that. We put a lot of effort and work into it. We have actually 5 to 7 people, believe it or not, that fully author the food code. And we also work with across the team with Andre's group, the specialists. They all give input, Alan's side of the shop as well, and OTED and our federal partners, FDA, CDC, USDA, and EPA. And so we put a lot of effort in doing that. And we've developed a retail food policy risk management process so that you can be assured when you adopt the code, it's risk-based, science-informed, and this process that we've developed helps inform our decision-making. It gives us a chance to establish a consistent, systematic approach to how we evaluate changes to the food code, and it sort of gives a standardized checklist, if you will, of topics that we need to consider, and really give us a historical record of the reasoning. Really, at the end of the day, everybody wants to know, why does it say that, right? Why does it mean that? What does that mean? And so that's what we're really trying to get at for the heart of that. And we've also been trying to get a data structure, an IT data structure for the food code, so it's more easily accessible to our state and local partners, so that as soon as it comes out, we can get you a copy and you can adopt it, whether that's a web-based source. We're still looking into best method to do that, but we're working to have that easily available to you. So you put it on your tablets, all type of ways that you do your inspections, and also have that with your state and local food codes. So lots of things going on there. We continue to work with our federal and state and local partners, and really just working in, there's a food safety prevention strategy, I should mention, coming out of our Office of Food Safety to help really limit future outbreaks. It's more on the manufacturing side right now. So as part of that strategy in developing that, FDA worked with food safety experts and different partners in state, industry, academia, and international partners, kind of hear their perspectives on what caused the outbreak. And what Alan said, why are we still getting the same old thing after all these years? So we're asking that question on the food side as well. So in the near future, FDA is going to publish some more information about this work. It'll be on fda.gov, and it'll include some summaries of commodity-specific food safety strategies that are currently being executed. So I'll stop there. We have a lot going on. I want to give time for Andre as well.
Yeah, Glenda, I was really impressed this week, hearing the data from CDC, Dr. Brown on Monday, and the linkages of those maps to the code, to the provisions of the code, and how that's, the research there bears it out. So it's really, really, it's the uniformity that's born out from the science. It's really interesting. So what's novel? What are we doing to reduce foodborne illness? I think post-COVID, we're back in the field, and we are supporting our environmental health specialists. And we hope you're reaching out to us that you can. I think that is almost novel, the way it feels at this point, that we're back in face to face and seeing each other. So it almost feels like a new novel in some ways. What happened in COVID that really was a novel thing, it propelled a lot of us to do Zoom meetings and that kind of thing. So some of these trainings, the 5 SAVA trainings that were offered last year, really expanded access to everyone to get in there to do the self-assessment verification audit workshops, so that you can really learn the standards, because you learn the standards when you're doing the SAVA workshop, as well as you're learning how to verify. But a large part of it is really learning the standards. So those five SAVAs are accessible, gave accessibility last year. We're going to be offering 4 more this year. There's some modules out there from now by an association that are going to make them available to you anytime you need. So that's good. What else is novel? We're offering the risk factor training tomorrow. So I hope as many of you as can come to that, because you need to do a risk factor study in your jurisdiction. And I'm not preaching to you, but I would encourage you to do a risk factor study in your area because it really shows the gaps. And that's so important. If you're going to do program improvement, I want to know where my problems are so I can start focusing my efforts. So that's a novel thing. And I really appreciate the specialists who got that together. It's not so much novel. I think we've known about networks and the value of networks and how much power there is in it. But there's a study last year that's validating what we really already know. And our specialists are already providing the networks around the country. When you get yourself plugged in with someone else who's working with the program standards, it really propels you. And I can speak to that personally. I've come from an area where we had some really zealous folks who were really interested in the program standards, and it really, really did help us a lot. So as far as novel things that we're doing, I think those are really important. And I think reaching out to your specialist and a real person and making those real connections is really where we want to go after this pandemic. I'll give it back to Kenya.
I agree. All good comments. And as a specialist, I know one of my favorite aspects of probably my most favorite aspect of the job is working and interacting with those folks in the field, like those EHSs, environmental health specialists, sanitarians, because that's where I feel the important work happens. I'm a little biased. I like my field folks because I started there too. So I love that. And one of the questions that I get a lot, and a lot of other specialists like myself have heard, is that there has been, we hear a lot of communication about the new era for smarter food safety. So as a regulator, a local or state regulator, how do they fit into that new era of smarter food safety? It seems like it's cloud. So if you guys were to address that question to a regulator, how would you answer that? I don't know, Alan, you want to go first for this one?
All right. Well, I think I know we all have I know there's several deliverables in the new era of smarter food safety. It involves a collaboration. We cannot do it alone. So it involves a full collaboration with our state, local, tribal, territorial association and industry partners. There are deliverables in the new era of smarter food safety blueprint that relate directly to regulatory as well as to industry as well. I'll just mention a couple that relate to industry. And one is the work to advance food safety management systems by our retail and food service partners. There is a FDA submitted an issue to the last conference for food protection, and that issue was passed, and there was a committee formed to provide us with recommendations on how we can better promote food safety management systems at the retail level. And we feel that this is really key to our work as regulators to be able to achieve to get operators to achieve active managerial control of risk factors in their establishments. And so they're going to be looking at, what are the barriers to implementing food safety management systems? Our collaborative partners have also been looking at that as well. They have been developing active managerial control courses and doing some surveys to identify what are some of the barriers to implementing food safety management systems by our retail and food service operator partners. And this is really going to be key in how we look at this going forward and how we can make the biggest impact, I believe, would be the food safety management systems. And then one other area I would say here is what is called for in the new era of smarter food safety is funding for you all to be able to do what you need to do. In fact, it directly calls for funding to state, local, tribe, territories to not only do risk factor studies, but once you've done those risk factor studies, to identify what you're going to do to lower those risk factors by way of implementing, comprehensive intervention strategies. Because it was in new era, we were able to increase the funding for the retail program by more than 100% in just a year or two. And I can tell you that there is a lot of emphasis on retail in the Food and Drug Administration right now. There is consensus across senior leadership that if we want to make a big dent in the foodborne illness statistics, we're going to have to put our money where our mouth is, so to speak, and help the retail programs out there. And with that in mind, here is my plug for the retail flexible funding model. The portal closes it's open until October 12th, so you have 3 more weeks. There's still time to get involved and get your funding to improve your program. So now Mary Beth can check that off on the list, because I have given my plug for that. That is going to help you improve your programs. So Janet, what do you think about this?
Well, I think for those specialists out there that are not familiar with the retail flexible funding model or the program, reach out to that specialist, reach out to your specialist and inquire. The one thing that I can think about New Era from Smarter Food Safety, what a powerful tool that brings everybody involved in food safety together to focus on the same thing. But it seems like that sometimes as you move the chain in an organization, people feel disconnected, or they feel that it doesn't apply to me, or how does it apply to me? Get involved. Go to the website. There's a website for New Era for Smarter Food Safety that talks about the 4 components, the core elements. It talks about what those elements are. It updates it every month because we have 1,000 meetings. It updates it every month about what's going on, who's doing what. Inform yourself about what's going on with the agency. You don't have to know it all. You have to know enough to know where to go look. It talks about the traceability. That's how you can open that conversation with your industry partners, with your operators. So when you talk about active managerial control, you talk about food safety management systems, you have a link, because now you're talking about something that is important to them as well, and bringing it into that language that they understand. And you may not know it all. You may not have all the answers. You may not understand all of what's going on. Your specialist can help you. You have the 4 components here that can provide that guidance, and it just staying involved along with CFP will get you what you need to know about New Era for Smarter Food Safety. It's not magic. It's what we have been doing. It's just we're all focused on it at the same time, the same way right now. Glenda, Andre?
You can go, Andre.
Yeah, I'm thinking about this question and how the local environmental health specialist fits into this. I think getting those intervention strategies that are really innovative and effective is really a way. If you're doing this work out there and you're getting these intervention strategies, share them at venues like this. I had an opportunity to hear a great intervention strategy yesterday it was last evening, like 6:30 in the Pacific region. I invite you to go back and look at that, where they had ethnic foods and they had little photos, and it was just a great intervention tool that they shared last night. So that's how we can make a difference in New Era, is coming up with these innovative ideas and sharing them in venues like this. We could mention also an adoption, a national strategy for food code adoption. That's already out there on the collaborative website. So how do we fit into that? How can we bring those things to our local boards so that we can get national uniformity around the code? Yeah, I'll stop with that. Go ahead, Glenda.
No, I said that's a good segue. That the piece I was talking about, that the IT data structure, that sort of feeds into, we can get that available for folks. It makes it easier to adopt the code. And I think though, in terms of New Era, people are putting their money where their mouth is, and they are spending it online. And for that segment of the retail modernization piece, we're finding more businesses to consumer. The business model is changing. More businesses to consumer, and they're still direct to consumer, but it's skipping the middleman, and it's going right to the consumer from the manufacturer. So we're looking at how we can adapt and find more and more of what these models are doing. There's also that last mile from the retailer to the consumer. What does that look like, and where are some of the options for how these meals are delivered in terms of regulating them? So a lot of questions came in. We had a global summit last October, and a lot of questions still came in. The majority of the questions came in around whether additional regulations or any changes in regulations are needed at either federal, state, or local level to address any of these risks that are perceived, or even maybe real risk as well. across the spectrum, whether it's food safety, food waste, food access to it. And it covers the scope of delivery, packaging, processing of the food. And so what we're doing in that area, and I'll get to what you can do to help us with that, we have two goals right now. We're going to look at regulatory scope and clarify what that is so that we can ensure adequate oversight for food sold through e-commerce. And that's going to be getting jurisdictional clarity around that. And then the second goal initially is to enhance food safety across e-commerce food sector. So from industry to consumers, and we'll be working in partnership with our federal and state and local partners. We start with federal, and we'd like to really promote. Remember, I started with the basics, and Janet started with the basics. The basics are out there. We have existing information, and some of that's through the Conference for Food Protection's guide in terms of direct to consumer, and they give information there. So we'll be promoting that, and then also working with you in technical meetings that we'll be setting up, and first getting this basic information out and working there. But where can you help right now? While we're determining jurisdictional clarity, tell us what laws or policies you have on your books in terms of e-commerce. What are you doing? Are you regulating ghost kitchens? Are you, and sometimes it might even have to do with the cottage food sales or some of the freedom food laws. But you can drop us an email at CFSAN Retail Food Policy Team at fda.hhs.gov, and be sure to copy your retail food specialist. And this will help us start to gather some of that information, get a picture, and look at that regulatory landscape that local state laws and ordinances are out there. I'll stop there.
Very good. And that was right on time, Glenda, to talk about the e-commerce and follow up from that summit, because there were a couple of comments and questions in the chat about that. So I'm hoping that addressed those folks' questions. So thank you for sharing that part of it. The next question or thing we can kind of talk about, and y'all have kind of mentioned some of it already, but some of those success stories, what are some success stories that you can share regarding some other recent FDA initiatives that have happened in recent years? Linda, you want to start with this one again, or?
Yeah, sure, I can do that. As I said, I'm always passionate and excited about the food, right? 30 years, yay. And so it's really the mechanism the agency has for driving that retail food safety policy and the science, and being an advocate for our state, local tribes, and territories. And so we're excited to share in the coming year more of the process for food code development, how the Conference for Food Protection is involved, and just the mechanism of the science behind it, and the input that we get from our states and locals and industry and academic and consumer partners for building the food code. We all go out to eat. We all want to be safe when we go out to eat, right? Well, at the end of the day, we're all consumers eating food. And so everyone has a vested interest. It's just in different areas or different aspects. So we're excited about that. We're excited about the Employee Health Handbook. We gained interest today. We heard about that. It's the #1 publication requested out of the FDA warehouse. The demand continues to be high over the years. And we also have on the website Decoding the Food Code. It's a module to help people understand and look at the preface. Sometimes we jump to the back of the book. We want to see what happened. Who killed? What's the mystery? Who killed it? Who did the crime? And we want to see it. But sometimes you got to start at the front as well. And so it talks about decoding the food code and some of the mysteries around it that people have. It got over 10,000 visits in its first month of release. And the food code webpage is the most frequented website in all of the FDA web pages. So it's a lot. I think, there are other program things that have gone on, the mentorship program for the program standards. I just love that idea that we can engage and network across the country, and how our components, our offices came together to help that happen. So I think those are keys. The food code toolkit, I could go on and on. The redesign in the food safety management systems and the risk factor studies. So lots of good things going on, and the research that I mentioned earlier too. But
I saw Janet came off mute. We got about 5 more minutes, but Janet, you got a comment? You can jump in.
I'm going to jump in there and just very quickly say one of the things I think I want to shout out to OTED for what it's been doing is increasing its capacity and availability for training. I'm just looking at the retail program alone, and because we've changed how we outreach to our state, local, tribal, territorial agencies, we are hitting more of those 2- and 3-person regulatory agencies. They're attending more of our trainings. They're accessing more of the online courses. So that does us well to know that it's not just the big guys, the ones that have all the higher voices out there. We're reaching everybody now. So our expanse is getting more. And we have more people clamoring for the information because I think people are appreciating the design quality and the science behind the quality and the design of our training, that it has that scientific value to it. So it is helping us support our standards that we are developing for retail to develop and help all of the work that these components are doing. Thank you.
Thank you for that, Janet. Oh, no, y'all can hear me. Yeah, we got about 4 minutes. So what I'm gonna do right now is I'm gonna ask for any kind of closing comments. And I know Andre was starting to say something, so we can kind of round robin real quickly. So Andre, what do you want to leave the folks with today?
I just want to say, I think I wanted to answer this question. I was trying to get in there. I think the biggest success that we have is you. You are the biggest resource that's our success. And when we make relationships and we work together, then you are making the difference. And so hands down, in my opinion, networks and mentorship program are where the spark gets going, where the fire gets going. I mean, it's you. You're the biggest success that we have, and our hope and our support is for you. So please reach out to our office in any support we can provide. Thanks.
Alan?
Yeah, first of all, I just want to thank you all for the time this afternoon. It was great to see you all. I too wanted to answer that last question because I think one of our biggest success stories these past few years is to follow up on Andre is partnering. I put a quote down here: "Alone we can do so little, together we can do so much," by Helen Keller. I mean, FDA and CDC as federal partners, we work tirelessly to reduce foodborne illness out there. But in the past few years, we have been able to partner with our association partners in the Retail Regulatory Association Collaborative. And so for the first time in history, FDA, CDC, AFDO, NACCHO, Conference for Food Protection, NEHA are all working together with a focal point to reducing foodborne illness and working on projects together to do that, leveraging our collective abilities and our niches and our constituencies. So this is a really good thing that we're doing here to improve food safety, and it's only going to get better. So it's been an exciting partnership to work with those associations, and we look forward to the years to come working with you all as well.
And Glenda or Janet? Glenda?
I guess everyone's kind of wondering, transition a little bit, when the food code's coming out. The next food code, the 22.
That's a big question.
That's a big question. Where our target is the end of calendar year 22, so the end of this year. And we're finishing the language and spot to go through clearance. And so that's our target.
And Beyonce, Halle, Janet, what you got?
I have nothing. My album is going to hit the streets in a second, and I'm sure to look me up. But what a great opportunity. I miss being in the field with you all, and I really appreciate the opportunity to share. Thank you all.
Put a ring on it, Janet. Put a ring on it.
That's right. That's right.
Yeah, Janet, somebody said they want you to close us out in song, so I don't know.
Well, I can close you out, but you all would be closing your ears when I was singing.
But it looks like we're about at time, but I want to thank you all once again for attending this panel. We wanted to do this a little differently than our normal canned presentations, for lack of better words. So hopefully you all found it enjoyable and you got some good information from it. And thank you for your attendance. And Christine, I think I pass it on to you, right?
show this afternoon. So thank you, Kenya. That was great. And thank you to the leadership team for providing such great information to all of us. That was really well received, and a lot of good comments in the chat there. So that is going to take us to our closing remarks of the seminar. But before I hand it over, I just want to say that it has been a pleasure moderating for you today. And I just want to remind all of you that tomorrow we will be having the risk factor study workshop. That's for all of our regulatory partners who would like to learn how to conduct a risk factor study, and for those who would like a refresher on how to do it as well. So hope to see many of you over there. Tomorrow it's going to be a great workshop. It's being facilitated by a great group of our retail food specialists, and they are just going to do a fantastic job. So please, if you can tune into it, I really encourage you to. So to close out our seminar, I turn it over to Andre Pierce again. Andre, the floor is yours. Close us out.
All right. Good afternoon again. We've come to the end of the 2022 FDA Retail Food Protection Seminar, and it was a wonderful meeting. And I thank you all for your active participation and engagement. As I said earlier last night, I think at 6:30 in the evening at the former Pacific breakout, there were 422 participants still on. And I think the former Pacific region facilitators can confirm that the chat was very lively. So it was really the most lively chat of all that I've seen. It was really incredible. I really enjoyed this year's focus on norovirus prevention. It's an area where we in retail really make a difference. So while we've made significant progress in the area of no bare hand contact, thanks to you, our continued challenge is to how to improve compliance with hand washing and employee health. I hope you could feel the energy here this week, because I really could. One of our speakers, William Hill from East Carolina University, said during the Southeast breakout, and it bears repeating, and I asked William, could I share it? Educate all who will listen and all who won't. Educate everybody, everywhere, every day. Make your own theme music. And if you get a chance to go back and listen to that segment yesterday, it was phenomenal. This harkens to our regulatory approach, personal approaches on how we impart this food safety knowledge to get that lasting behavior and eat the change in the kitchens. Understanding goes a long way at promoting our mission. We've heard a little bit about that today in the communications. We've heard a lot about that today in the communications piece of the general session. So looking back on the seminar, real briefly recapping, on Monday, we heard the latest on norovirus vaccine development, how the provisions of the code are preventative against norovirus outbreaks, how restaurants with strong food safety management systems make a measurable difference in mitigating norovirus outbreak size. We heard about how these data inform public policy, which really provides the best case for national food code adoption with all the provisions of the code, the first objective of the association collaborative. On Tuesday for the breakout sessions yesterday, I tried to roll across all the time zones to listen, but there's no way to see all the presentations that overlap. So as Christine said earlier, use this resource to go back and listen to them, because there's so many good ones out there. The breakouts were awesome. I really, really appreciated dropping into the different ones. Stories really resonate with me. So it was so nice to hear how the outbreaks unfolded. And in one presentation, we heard of two norovirus outbreaks at the same facility. You can't make it up. We also heard that story theme with the outbreaks today and on Monday at the national parks. Really, really cool. Our retail food staff shared your jurisdiction's accomplishments with the program standards during these sessions, and that was really amazing. In one regional breakout, I'm going to ask you to chat something in a minute. One state report took 5 slides to list its program standard accomplishments of its jurisdictions. Congratulations. If you know the name of that state, put it in the chat now. In the former Pacific region, it was great to see pictures of you when you won your awards. with your teams actually holding up the certificate. So recognizing your accomplishment, but really recognizing the people who've done the work. I really thought that was a nice touch. In the Southeast, of course, we enjoyed hearing about the accredited schools and how they're really bolstering the workforce, getting people interested in environmental health every day, all the time. The energy in that session was a boost. It was a shot in the arm for me. It was really, really nice. Southwest session, there was an engaging panel discussion with Colorado, Iowa, and Nebraska's Lancaster County on standardization, where it's very apparent that standardization is a real important part of state and local programs to ensure staff have knowledge and skills and abilities to do solid risk-based inspections to protect public health. In the central breakout, the Minnesota Department of Health presented about their innovative operator survey, looking at how well food safety information is received. And they found the observations with inspectors, they found that the best communications was when the inspectors came to share the food safety information. So it shows the benefit of the value you're bringing and how you make the change in your community. And I'll finish with this part. Dr. Shoemaker, last night at the Pacific breakout, I liked your comment about fermentation and how it relates to your favorite drink. And so that gave me some food for thought for the weekend. All this to say, there are so many good things in each breakout, in each general session. And I thank the retail specialists for planning these relevant presentations. Congratulations again to the newly FDA standardized inspection officers who were recognized in the breakouts. Like I said Monday, I challenge you to use your credentials to standardize others deliberately and with a fury so that our efforts, our work at uniformity can cascade and be multiplied throughout your staff. Now, today we heard a lot about communication, as I said, and food safety culture. We heard about how using language and tone makes a difference. And we heard a good example of that in the employee health videos at the end of the general sessions today. They were great job to Guam, great job to the jurisdiction in Connecticut. I really like the way those were done. Very good. Over the last 3 days, we've been equipped with excellent resources from experienced researchers and practitioners. So the question I'll leave you with today is this: where do we go from here? I'll share the same quote from Atul Gawande that I used during my welcoming comments. Better is possible. Above all, it takes a willingness to try. How do we change food safety culture to reduce foodborne illness risk factors in our facilities? How do we achieve lasting behaviors that will improve food safety statistics come this time next year? We can conduct and model risk-based inspections focused on risk factors. We can promote food safety management systems that lead to better active managerial control. But to get there, we have got to make a connection with our food establishment workers. We've got to motivate and encourage. We have to use a personal approach and understanding that helps resolve food safety concerns. That builds the relationships that are the foundation of a culture of trust and change. Relationships encourage the willingness to make things better. So as I close the 2022 FDA Retail Food Protection Seminar, I extend my gratitude to the presenters who took a lot of time to bring us engaging and informational presentations. To the work group, you guys worked tirelessly, and we worked through this week, and it was a great presentation, great seminar. And to the retail food specialists who really made all this possible. I thank also the National Retail Food Team who came today to share context for how we support each other in the components. But most of all, I thank you, the state, local, tribal, territorial, environmental specialists. I thank you for allowing us to be your partner. Thank you so much for coming. Now, we look forward to seeing you in person in 2023. Until then, let's make things better. Thank you.